Imagine two similar-looking engines into very different types of vehicles. One is a sleek sports car, needing specialized high-octane fuel and precision tuning. The other is a robust utility truck, requiring durable parts and a different kind of maintenance. Both are powerful, but their fundamental nature dictates vastly different care. Why is understanding this difference so critical? Distinguishing between non-small cell lung cancer, or NSCLC, and small cell lung cancer, or SCLC, is profoundly important because these are two completely distinct diseases that requiring very different treatment approaches. They behave differently, grow at different rates, and respond to therapies in unique ways. Knowing which type someone has is the foundational step for all subsequent medical decisions, directly impacting the effectiveness of treatment and the patient's journey. The primary reason for this critical distinction lies in their cellular origins and growth patterns. In SCLC, which accounts for about 85% of all lung cancers, typically grows and spreads more slowly than SCLC. It often presents as a larger, more defined tumor. In contrast, SCLC, though less common, is notoriously aggressive, characterized by rapid growth and an early tendency to spread to distant parts of the body. These differences mean that what works for one type might be ineffective or even harmful for the other. For example, surgical removal is often a valuable option for early-stage NSCLC but is rarely used for SCLC due to its widespread nature at diagnosis. Doctors make this distinction through a process called biopsy, where a small tissue sample is taken and examined under a microscope by a pathologist. This microscopic examination, along with specialized tests like immunohistochemistry, helps identify the specific cell characteristics of the cancer. They look for markers that confirm whether it is non-small cell or small cell. Further subtyping of NSCLC is also done to identify specific mutations, which guides targeted therapies. An interesting detail is that the name small cell directly refers to the appearance of the cancer cells under a microscope, which are indeed smaller and rounder than non-small cells. Historically, SCLC was strongly linked to smoking, even more so than NSCLC, although both can affect smokers and non-smokers alike. This cellular difference drives everything from initial staging to the type of chemotherapy or immunotherapy selected, highlighting how microscopic details profoundly influence macroscopic treatment strategies. Ultimately, recognizing whether a lung cancer is NSCLC or SCLC is not just a medical classification, it is the roadmap for care. It ensures that patients receive the most appropriate and effective treatments tailored to their specific cancer type, optimizing their chances for a positive outcome and helping them navigate their individual path with the greatest possible confidence and clarity.